Reasons for hysterectomy include uterine fibroids, abnormal uterine bleeding, endometriosis, or pelvic organ prolapse. There are going to be some patients for which different types of hysterectomy are better suited. The single incision hysterectomy is another option for hysterectomy that involves one small incision, approximately 1.5 centimeters to 2 centimeters, that's placed directly into the umbilicus or the belly button or just below the belly button. A port is placed into that incision through which all the instruments can be passed to remove the uterus. This differs from traditional abdominal hysterectomies that involve one large incision in the abdomen. Vaginal hysterectomies, which are done completely through an incision in the top of the vagina, and laparoscopic and robotic hysterectomies that are done with several, usually 4 to 5 small incisions around the patient's abdomen. Potential advantages of the single incision include possible reduction in pain. Usually there is pain associated with more lateral incisions into the muscle, and the single incision doesn't generally go through any muscle. There's usually a very short recovery time, typically 1-night hospital stay. Patients can be advanced to a regular diet and are often on just oral pain medications after they awake from surgery. After returning home, they can typically return to normal activities in approximately 2 weeks. Patients who have had a lot of abdominal surgery and have a lot of internal scarring from previous surgeries, such as C-sections, might not be the best candidates for the single incision laparoscopic hysterectomy. Patients that have large uteruses or uteruses with large fibroids might not be great candidates for this type of procedure either. It really depends on the ability to visualize the areas that we need to and maneuver the angles with the instruments that we have through that single incision.